Put on the ashram geet. All the girls are requested to fold their hands for the prayer. Thank you. He vanya ashramadva maase pranama dhyave. He vanya ashramadva maase Now we shall have the Eve Puja. On behalf of all our guests of honor and all of us, we have given flowers to the memory of Maharishi Karve and the entire team of his. Now may I request the guests to please join us on the dais. Principal of our college, Dr. Samita Athule, and well-known psychiatrist, Dr. Swati Joshi, joining us on the dais. We welcome our chief guest and begin with the program. All the students and faculty once again are requested to keep your mobiles on the silent mode. Thank you. Dignitaries of the days, distinguished guests, honorable office bearers of the Samstha who are with us, my colleagues and friends. Today, a song was playing in my mind since morning. सीने में जलन, आँखों में तूफान सा क्यों है? इस शहर में हर शख्स परेशान सा क्यों है? सीने में जलन है, आँखों में तूफान है और हर एक इंसान बहुत परेशान है. I think this is the gift modern world and technology has given us. Technology made our lives simple, but at the same time it took heavy price for that, and it has given us two things in return. Let's welcome Vidyatari Kulkarni, chairperson of our Samstha. Please come on the dais, madam. Madam, you are requested to join us on the dais, please. Please, madam. Okay, madam. Not an issue. Please do come. Let's welcome Vidyatari with a big round of applause. We are honored by your presence, madam. Thank you so much for making it. So, as we were talking about the people in modern cities being extremely unhappy and stressed. So, these are the two gifts given to us by this technology: depression and stress. And added to that was the COVID pandemic situation. We really didn't know what it was, from where it came, and how we are going to deal with it. So the conference is arranged on find out various aspects and various methods to deal with this stress. And I think we have the most appropriate guest today with us who can guide us about dealing with stress, especially during situations like the pandemic, Dr. Swati Joshi. Dr. Swati Joshi is a renowned psychiatrist, and she has done her MD in psychiatry after doing her MBBS, and she has been practicing it since 1996. Currently, she is associated with Sneha Clinic at Kothurud, and she is also a consultant psychiatrist at the prestigious Dinanath Mangeshkar Hospital. Madam was also associated with the other noble field, that is teaching. Medicine is one and teaching is the other. As she has taught at the BJ Medical College, and she was also the head of psychiatry department at MIER College at Talegaon. She was also the head of the department and professor over there. She has several research papers and publications to her credit. The stress is not only given in the pandemic, there are other situations also when a woman is carrying a baby. That could be one of the most stressful situations for her, and Madam has given a telephonic helpline for such women. Madam, we are extremely honored to have you with us today. Can we have another round of applause for her? And I would also like to welcome her. May I now call upon Vidyatari to please felicitate Swati Madam. Thank you so much. We would also like to welcome formally Vidyatari Kulkarni. So may I call upon the volunteers to get us the flowers first. And now, may I call upon our principal, Dr. Samita Athole Madam, to please welcome Vidyatari. Thank you, madam. Now we are in the last and concluding day of the conference, but all of us would like to have a small recap of what has taken place in the previous day. So I would like to request my colleague, Professor Shriya Umrani, to present a brief review of the conference. Thank you.
Thank you so much, madam. Myself, Shriya Umrani from Department of Microbiology. I am here to summarize the two-day national conference on stress management during COVID-19 pandemic organized by Maharshi Karvestri Shikshan Samsthas, Shri Siddhivinayak Mahila Mahavidyalaya in association with Shrimati Hiraben Nanavati Institute of Management and Research for Women. The main objective of this conference was to bring together leading personalities, researchers, students to exchange and share their experiences. It was meant to provide a platform to present and discuss the concerns as well as challenges encountered and solutions adopted for stress management during pandemic situation. The first day of the conference started with an inaugural session with a welcome note and conference overview by our principal, Dr. Samhita Athavale Madam. Dr. Nitin Karmakar Sir, Vice Chancellor, Savitribai Phule Pune University, Dr. PVS Shastri Sir, Secretary, and Dhananjay Kulkarni Sir, member of Maharshi Karvestri Shikshan Samstha, graced the occasion. In the keynote address, Karmakar Sir highlighted the challenges faced in academia and mentioned about the research activities conducted throughout. Dhananjay Kulkarni Sir focused on effect of mental stress on physical health. The technical sessions followed the inaugural sessions. The two-day conference comprised of 3 technical sessions. In technical session 1, Shrimati Prerana Katte Madam, Assistant Police Commissioner PCMC, shared her on-field experiences during lockdowns. She motivated our students for pursuing their careers in police services. Shrimati Mukta Puntambekar Madam, Director, Muktangad Rehabilitation Center, gave brief introduction about the center. She talked about various types of addictions and challenges faced by them and solutions adopted by them during pandemic situation. Technical session 2 was held online with distinguished speakers. Dr. Miran Chadda Borwankar, ex-Director General Legal and Technical Maharashtra, ex-Commissioner of Police Pune, addressed the issues of women police officers during COVID-19 using case studies and the ways of stress management. She also emphasized on the need of new strategies to be introduced at administrative level to reduce the stress levels. Shrimati Anjali Dhanorkar Madam, Deputy Collector Aurangabad, discussed about the official and individual stress through personal experiences. She threw light on work-life balance of women during pandemic situation. Madam wonderfully explained the power of positive thinking and helping others as novel strategies of stress management and gave us new insights. Dr. Kalpana Balivant Madam, AMOH and Authority for PCP-NDT Act PMC, shared her experiences during cremation management and associated stress at second COVID wave. Last technical session consisted of paper presentation by research scholars, students and academicians. More than 50 research papers were reviewed and accepted for the publications. The conference was structured to foster the discussion between the participants and emphasized the need to manage the stress incurred during COVID-19. Thank you.
Thank you, Shreya Madam, for the wonderful summarization of the conference. Now I would like to request our chief guest today, Dr. Swati Joshi, to guide us to begin her presentation. Yes. Oh, sure. Since Madam would be making a PPT presentation, I would like to request the guest to please be seated in the front row. Thank you.
Good morning, all of you. Respected Vidya Madam, Dean of this college, Principal Madam, teaching and non-teaching staff, and dear students. I thank Siddhivinayak College for inviting me as a speaker on this conference on stress. Just now I heard the report of what happened since yesterday. So I think it made my lecture little easier, because now you are aware of what is stress. But at the same time, it made it difficult, because now I am wondering what to talk about, because most of the things now you are knowing. So I think I will restrict my talk, or I will just talk up from the doctor's point of view. Is that okay? So there will be little revision in first few slides about stress, which you are already aware of. But to make the presentation smooth, I think it's essential. Next slide. Okay. So, as all of you are aware that what is stress, from doctor's point of view, we feel that stress is a body's reaction to a change that requires physical, psychological, and behavioral adjustment or the response. And it is body's way of responding to a challenge and preparing to meet a tough situation with focus, strength, stamina, and heightened alertness. For example, if you are driving the car and somebody overtakes you from the left side, and you realize that if you don't stop it or you don't use your brake, you may have an accident. So these few moments will be stressful for you. As there are so many, most of the participants are female. We, in our day-to-day life, many times experience sudden stress. For example, if you have planned your day and suddenly in the early morning your maid calls you that, "Madam, I am ill and I am not coming to work for today." So what is your reaction? You are on your toes, because you have to manage so many things in that short span of time before leaving for the work. So you have to do extra efforts and make necessary changes to meet the demands of the family member and your whatever organized requirement. So that few hours are stressful. We all experience this day-to-day stresses in our life, isn't it? Yes. And we are tuned to it and we try to find out some or the other solution. Sometimes we are successful, sometimes we are not. When we are successful, we feel happy. Oh, I made it. And many times stress makes you to work more with that happy feeling. And sometimes you are so stressful and you start thinking negatively. सारखं माझ्याशीच असं का होतं, नेहमीच माझ्या बाबतीतच असं होतं, कोणाला माझी काही पडलेली नाही आहे. These all negative thoughts comes in your mind and you feel stressful. So these are the few examples we all experience in our day-to-day life. So I think stress is a personal feeling, or it varies from person to person. For someone, the event is stressful. For someone else, the same event would be pleasurable also. Like this, excessive amount of work may be stressful for someone, but for someone who is workaholic or who like to work a lot, for that person, it's a challenge, and it gives him extra energy to do it. So same event may be stressful to someone, or it may not be stressful. It depends upon person to person. As I said, the same example, if someone is workaholic and he feels that, oh, whatever extra work I get, I am happy about it. I want to do so many things. And even though he has to challenge himself or herself, still with that positive motivation, I can do it, or I want to do it, or I want to make it successful, and it gives pleasure. And that positive stress is known as eustress. But sometimes the same extra work might be having negative impact on somebody. Oh, माझ्यावरच काय येतं नेहमीच, मला काय एक्स्ट्रा काम करायला लागतं. That negative thoughts create negative emotion with fear, anxiety, or pessimistic thought. No, not possible, I cannot do it. And this negative emotions and negative your self-talk is a distress. So most of the time when we use word stress, we usually in our mind, almost all people, our mind, the word distress we use as synonymous with the stress. Okay, so this is the few perspective of stress. So how stress is produced? We are experiencing so many things in day-to-day life. Some are daily hassles, some are things which happen suddenly, and we need to adjust our resources, emotional resources, physical resources, and other resources also. So when any change it happens in your life and it perceived as unpleasant, or when demand is greater than the need, so resources, and when you have a feeling that oh, I cannot cope up, then it produces negative stress, that is distress. Means now we will consider distress as a stress, to make it simple. So there are so many events, few have listed, many things you have experienced in your day-to-day life, or in yesterday's lecture also, causes are enumerated. As a medical professional, we think stress is a biological and means internal or external. Internal stress may be your thought process, or sometimes there is some infection, severe infection, there is a trauma, severe loss of blood that is stressful to your body. But you are not talking infection or this trauma or loss of blood, shock reaction in this lecture. But we are talking about internal stress like your negative thought process. And stress may be acute or chronic. Acute means suddenly it happens. That is known as acute stress. And chronic means if the stress is lasting for a long period of time, then it becomes a chronic stress. Both have a different implication on your body. Few examples are, as I said, your med is not coming, so the daily hassles, so many things we are experiencing. So I won't go in detail. Then nowadays students are experiencing stress during their school or college days. Extra means you have to perform well, then you have to perform or make the assignment ready in a time. That may be stressful for someone, that may not be stressful for someone. Nowadays, I have few young patients who were stressful because one was telling that I have a very few Insta likes. That made him stressful, and he was not able to cope up that. During pandemic, one young adolescent came. He was very stressful. He was very anxious and going in a stage of depression. So I asked him, "What is your issue?" He was just recently started working, and then he was telling that all my friends are so much enjoying and I am just sitting at the home. I said, "How you come to know that they are enjoying in this lockdown?" "No, madam, you don't know. they have posted so much photos on the Insta account, someone at a beach and someone at some hotel or resort and so many things. And I'm not going anywhere. So I don't have friends, nobody likes me, nobody wants to communicate me. So this made him stressful. So it depends upon person to person. Then I asked him, just check it, whether they are new photos or older one. Because many times it just, students are doing, they just share the old memories and others feel that just few months or few years, 1 or 2 years ago, there won't be much change in their appearance. So other students will feel, oh, we are gone somewhere and we are here, just doing nothing and getting bored. This happened during pandemic with a few people. Then relationship issues. Relationship issues with anyone, with your friends, with your family members like parents, kids, then with your co-workers. When you are not on the same page, means when your thought process don't match, then sometimes it produces stress. During pandemic, many times females were very much stressed because they have to do so much extra work, particularly those who are working women. They have to manage their office, they have to manage their home, their kid, their whole kitchen, laundry, everything. In few families, there were cooperative other people in the family, they used to share all the work, but for those females, that sharing was not there, they were very stressful because of this overwork. Then family disputes, particularly those living in the joint family or a nuclear family also. All here, most of the females, many times, sasu sun vi samvad. It is very common. I can give you one example. I have one patient who was doing professionally very good. She was CA and having her own practice. She was at the age of around 30-35. Was referred from her physician because she had started developing diabetes. It was in an early stage. So that physician felt that she is going through stress. In initial visit, she said, no, doctor, I don't have any issues. But recently my mother-in-law is now staying with me, but it's okay. Then I asked her, just tell me how you get along with your mother-in-law. How is your communication? नाही मी काही विशेष बोलत नाही. म्हटलं का नाही बोलत? त्यांचे माझे विचार जुळत नाही. म्हटलं बाय, because she is a perfectionist lady. She wants everything to be neat, clean, in time, and her mother-in-law was not like that. So मुलीला जरा खाली सोडायचंय. I can't trust on her because कधी कधी असं होतं की मुलगी खाली गेली ती खेळते आणि ह्या त्यांच्या मैत्रिणींची गप्पा मारत बसतात. तिला काही झालं तर काय? और कधीतरी असं होतं because she was around 75, she forgets sometimes things to get it done. एकदा मी गेले आणि तिथे मुलीला औषधच नाही दिलं, so I have to check everything. मी म्हटलं पण it's okay. These are the issue and so you don't trust, so you take extra load on yourself. Gradually she realized her thought process. Then we made her understand how your thoughts are disturbing you. Because everything should be perfect. That झालंच पाहिजे, छानच पाहिजे. This her own expectation were giving her stress. Then many times financial issues during COVID times, many have experienced because of loss of job or less payment. Then it made them susceptible to stress. Health and illness in the self or the family, particularly acute illnesses like sudden heart attack, sudden stroke, make family member stressful and even patient also stressful. Then various environmental causes. Nowadays there is a war in between Russia and Ukraine. You can imagine the situation of people over there. They must be going through a lot of stress. During our earthquake in Latur, there were so many people were stressed because of earthquake. BJ Medical College, that MIMH Institute had served there for a few years just to rehabilitate people emotionally over there because it gives a lot of stress. During COVID living situation, when so many people, particularly in this lockdown happened, a small house and everybody has to do work online, school online, and there is no place. Or in a low socioeconomic strata, just one room, and imagine during first lockdown, nobody has to go out. That small house, everybody in there during 24/7, and many have alcoholic husband, and it created a chaos. I have a police officer who was friend to me. She was saying that daily we are facing phone calls. We are getting phone calls for rescue because of this stress. There is a physical abuse. Then personality factors. Your way of thinking, attitude towards the life. It is also, I would say, it is the most common contributing cause. Because, as I said, if you are perfectionist, you are less flexible. Depending upon the situation, you need to be flexible to get the things done. But if you are not, then it makes you stressful. Or some people are from inborn have a tendency of anxiety. We in a medical term call it as a trait anxiety. Means त्यांचा स्वभावच काळजी करणारा असतो. अरे बापरे काय होईल, मी पोचू शकीन की नाही वेळेत, ह्यांचं मी सगळं नीट करू शकीन की नाही. So any small event make them anxious, whether everything will be good or not, they can do it properly or not. So these personality factors are also contributing for the stress of a human being. This is the internal cause or personal cause. So the list is endless. You name it and that event can be stressful for someone. Physical abuse may be stressful, particularly in the female postpartum period. As study shows, 80% of the female experience postpartum bloop. Means they are anxious, they are sometimes depressed, but this is a physiological response. And over a period of time, within 2 weeks, it just goes away and female would be normal. But for some female, if their ANC, means antenatal period, is not good, or they have many conflicts in the house, poor nutrition, and sudden change of the hormone, may in some female may land up in the postpartum depression. During COVID times, acute grief was also one of the stressful event. Acute grief means if you lose someone, your near and dear one, particularly it happens when a sudden death happens. You are in a state of shock. असं कसं झालं? हा माणूस जाऊच कसा शकतो? During COVID times, it happens many times. You lose your near and dear ones, particularly those who are young adults or in a middle-aged people. Lots of people have faced this grief. Some those who could not manage their grief, they end up in depression later on. Recently, you have read the news in the paper. Some doctor in the Rajasthan had committed suicide. Are you aware of it? What is it? It was acute stress because she could not handle whatever the incidents has happened. So if she could have thought it some other way, might be or taken, means it was a feeling that now I cannot do anything because the charges against her, whatever the police had falsely put on, she was devastated emotionally, and then she took that step. I think there is a, the chain Cafe Coffee Day. Yes. That owner had committed suicide. Isn't it? Because of that, he felt that he could not recover it, he cannot face the people, and because of this huge loss, he might be in depression, and then he had taken that step. But the other story of his wife, all of you know? Yes. In the same situation, she fought with her positive attitude and then now recovering the loss. So here, your thought process is very important to recover from the stress or to face the stress. So, let's see what happens during stress in your brain and body. As I have given example, if you are driving a car and suddenly someone just overtakes you from the left side and you need to brake your car suddenly, you use the brake, and then that few seconds is very much tense for you. छातीत धडधड वाढते, कसं तरी व्हायला लागतं. Even in exams, many students experience this stress. मला जमेल की नाही, मला येईल की नाही, थरथर होते, धडधड होते. Your heart starts pounding, you get a mental block, you don't just forgets everything, isn't it? So this is an acute stress reaction. So what happens when your brain experiences experience that some danger is there, it activates one of the brain organ that is known as hypothalamus. This hypothalamus then get activated because of fear response. Then it produces certain hormones known as CRF, that is corticotropin releasing hormone. This hormone activates the pituitary gland, which releases hormone known as ACTH, that is adrenocorticotropin hormone, which stimulates your adrenal gland, which is above the kidney. It means just at the tip of the kidney that adrenal gland is there. When adrenal gland gets stimulated, it produces cortisol. You must have heard the word steroid. It's a natural steroid. Cortisol is a natural steroid. So, steroid in our body, daily twice there is natural release of steroid to make your body sustainable to day-to-day events or internal toxins. Fight with the internal toxin. It helps to boost your immunity. So during stress, this cortisol get activated, and then this cortisol stimulate your autonomic nervous system. Autonomic nervous system has two portions. One is sympathetic and another is parasympathetic. When during stress, sympathetic nervous system get activated, so body starts using its resources. So during that time, what happens? Your heart rate increase, you must have experienced palpitation, because your heart has to pump extra blood very fast, so it needs to work hard. Then it releases the energy in the form of glucose. So if your body produces extra glucose from your resources like fat and other things, then all the blood flow goes usually to the periphery, to the muscle. So during that time, you are in a position to either fight or flight. So for that you require muscle should be active. So blood supply to the muscle is very high. And you must have experienced body becomes stiff or rigid. It happens because of that. For heart function, proper heart function, there is a storage, excess storage of sodium and water retention happens. So blood pressure rises. There is a excess stimulation of secretory gland, so sweat gland, so you start sweating during stress. So all these are the normal reaction to combat the stress. Once that stress event goes down or you have some resources to overcome it, gradually it subsides and parasympathetic stimulation take over, which calm down all these effects. If the stress is going on continuously, body naturally tries to resist it. This is a stage of resistance. First stage was alarm reaction, means flight or flight response. Either you face it or you just run away from it. And as the stress just continue for months together or years together, like financial stress or personal stress or your internal thought process stress, whatever continue, then what happens? Every organ has some capacity to fight. If stress continue for months or years together, then the resources get exhausted. So when these resources get exhausted, it makes changes in your physical milieu, then structural changes in your body and psychological changes. So because of during this period it modifies your immunity and inflammation. So you are susceptible for various diseases. You are highly prone during stressful time. You are highly prone for infections. Your immunity goes down. so you cannot fight your stressful event. When there is a psychological changes, initial anxiety gradually turns into depression because person feels frustrated. काही होणार नाही, मी किती प्रयत्न केला तरी. Once this feeling starts, then person lands up in depression. Sometimes it ends in suicide also, or committing and then there is a structural changes in all your organs. It's not only the mind or brain. All organs get affected. So these structural changes affects your gastrointestinal system, cardiac system, respiratory system, skeletal, muscular system, reproductive system, everything. So what happens? So during chronic stage, stress, if you cannot cope up well, then because of taut muscle, constant headache is the common symptom. Various aches and pains in the body, usually in the stressful situation. Your heart needs to pump extra energy, so and there is a retention of water and sodium. Gradually person may develop hypertension, or sometimes already hypertensive, the blood pressure fluctuates and you need extra medicine to control it, and sometimes even with extra medicine also, till the stress is not controlled, blood pressure is not under control. The same thing with diabetes. Stress may be the cause of developing diabetes because of all this constant high level of glucose for months or years together fails your insulin resistance, and then insulin no longer able to work its glucose, keeping the glucose at a normal level. So diabetes may develop, or already diabetic, the fluctuation in the glucose level is very high. Then commonest would be the anxiety and depression. Sexual problems like erectile dysfunction, impotency, then many females experience infertility. Many times menorrhagia, means excess bleeding during periods during stressful life events. It's very common. If skin is inflamed, because skin and brain are developed from the ectoderm, so they share the same hormones. So many times stress induces certain skin disorder, or they exacerbate certain skin disorder, like acne, pimples. Many times you all have experienced when you are stressful, your pimples flare-ups, or pimple itself because of your secretory gland excess stimulation, you feel depressed also because your appearance. Few days only, one young female told me, "Doctor, I am very happy with this mask." I said, "Why?" कारण की मला खूप पिंपल्स येतात, तर मास्क लावला की माझं ते दिसत नाही. So I am very happy. So she had took it in a positive way using the mask. Then pruritus would be the common thing. Alopecia areata sometimes. Then trichotillomania, pulling the hair. It's because of irresistible urge during anxiety. Then many patients worsen asthmatic condition, respiratory condition. Because what happens during stress, your respiratory muscle also become taut. And already those who are having respiratory disorder like COPD, chronic obstructive pulmonary disease, their airway passage has been constricted. And here you feel breathless during anxiety or during stress. You need to use extra oxygen to calm down yourself. But here the lung has don't have that capacity. So there is a worsening of such disorders. Few days back, one of my patient who was coming to me since last few months only. He came to me for his anxiety and depression issue. We have started him on medication because he had tried everything and nothing was working. In last visit, he told me, "Doctor, I am using that pump for my asthma, but since last 1 month, I rarely require pump. Because of anxiety, he has a bouts of asthma was already there, but it used to precipitate during his anxious period." Then GI problem, as the gut motility get altered, many people during stress develop irritable bowel syndrome or gastric reflux, acid peptic disease. Peptic ulcer is because of H. pylori, but Many times, as the gut motility disturbs and stomach emptying time get delayed, so all the food gets upward and it causes acid reflux. And then, so many times, treating anxiety or depression elevates this symptom because the stress is less. Addiction, very common. Using tobacco just to relieve stress, using alcohol to relieve stress, using marijuana to relieve stress. Addiction can happen at any age. Usually in adolescent age when they start for fun or because of peer pressure. But we always check if a person has started using addictive substance after age of 25 or 30, make sure that he is having depression or any kind of mood disorder. This is the way of dealing with that stress or depression for many people. So addiction is also very common, and yesterday Mukta Mundakar had given you a talk on addiction. So you are very well aware that what happens during addiction. I won't go in detail. So what are the physical effects of stress? These are the during acute stress, what happens? Your heart rate increases, so you feel palpitation, you have excess sweating, headache, aches and pain in the body, shallow breathing means you feel breathless. Many times you feel just to urinate, defecate, nausea, vomiting, diarrhea. Then there may be weight changes, sleep and appetite changes. Many times many people don't sleep at all during the stressful period, particularly exam period. झोपच येत नाही. किंवा some people sleep excessively also. Then what cognitive changes happen? Forgetting, poor concentration, worrying, negative self-esteem, loss of confidence if stress is going on. Many times, particularly those who have a performance anxiety, means they are studying well, preparing well, but back of mind they have thought whether I can perform well or whether I will remember or nahi झालं जमलं तर काय. This is known as performing anxiety. So when they enter in the exam hall, suddenly they become blank. Once they come out of exam hall, अरे मला तर सगळं येत होतं, मी नाही लिहू शकलो. This is a performance anxiety. If you take proper treatment during that period, just before, if those students who are explaining it repeatedly, many times we can help those people. I give you an example. I have one patient who was doing his CA. He had 3 attempts of CA. Last group, he could not clear it. His father was my patient for anxiety depression, so I have a very good rapport with him. So when he came, that boy never failed in exam, and you all know CA exam is very tough. So when there was a first failure, he was very anxious, and he used to study a lot. Her performance was good, but during exam, when he enters the exam hall, he just becomes blank. For such people, temporary medication also helps. During last attempt, he cleared his exam, now started working. So, many times, just for that crisis period, if you take treatment, it may be counseling, it may be medication, it depends upon what your issues are. Let that professional to decide whether what kind of treatment you require. Then emotional symptoms, anxiety, worries, negative thoughts, panic, depression, sometimes irritability. आपल्या मराठीत एक म्हण आहे, वड्याचं तेल वांग्यावर निघतं. You are disturbed because of something and you just take out your anger on someone. Isn't it? So during stress this happens very commonly. Then because of this stress, if you are disturbed emotionally, you are in depression, so you cannot work well, you cannot behave with other people well. So there are a lot of misunderstanding and relationship get disturbed, which also adds to your stress. की आता माझं आधी एवढं छान जमायचं, आता काय लोक माझी नीट वागतच नाही. But because of his behavior, people just keep distance from that person. Your work performance also reduces because you feel मला काही जमतच नाही, कशाला काम करू, जाऊ दे. And this may lead to absenteeism, frequent mistakes, accident proneness, and addictions. So we have discussed what are the long-term effects. Okay. Then why to treat stress? As I enumerated so many long-term effects of stress, if you don't treat it, then your physical condition get worsened day by day. Particularly chronic diseases like diabetes, hypertension, which may lead to stroke. Then because of diabetes, all your confidence goes down if there is a constant fluctuation in your sugar level. Studies have shown that stress has a serious effect on medically ill patients and often a risk for medical conditions. Stress is both the risk factor and poor prognostic indicator in a coronary artery disease. If you are stressful, you are not using your optimum resources to get out of it. Because of stress, anxiety and depression, you are not utilizing your resources, and then it further deteriorates your condition. Stress worsens the cardiac morbidity and mortality in patients with a history of myocardial infarction. Stress diminishes the glycemic control in patients with diabetes. Long back, I have one female lady who used to work in some college as a professor, and because of her personal stress, she gradually developed diabetes and anxiety episode. So what happens during that anxiety episode? She starts to feel so restless, and she had that suffocating feeling, something wrong is going to happen or I will die. That anxiety episode gradually worsened because she had never took treatment, and then it made her homebound. She just gave resignation from her college because she could not go to college as she has to commute for 3-4 kilometers. Because of this panic episode, she started developing phobia, or that fear of crowded places, or fear of staying alone in the home, or during transit if something happens, what I will do. So this anxiety made her homebound. Gradually, she started feeling depressed because she was working woman and now she has to stay at home. Her whatever personal issues were not getting resolved, and all this made her depressed. So when she came to me, initially we started with her with antidepressant. Once she improved, then we started realizing what are the main core issues. We started working on them. Over a period of 2-3 years, her fluctuation in glucose, means this diabetes, came under control. She started going out on her own alone, and then she decided, I want to work, but now no, there is a gap of 4-5 years, so I am not going in teaching. Then she found out her passion was fashion designing. So she took over that interest and then started a boutique and running it very well, just because she could control her stress. Stress decreases the return to the functioning in patient experiencing stroke. Many times, stroke itself is an emotional turmoil on the patient, because in stroke what happens? Stroke means paralysis. When person develops paralysis, there is a sudden shock, मेरा हाथ हालत नहीं है, पाय हालत नहीं है, and if that person is under stress, he don't have motivation to do the physiotherapy exercises, and if they don't do physiotherapy exercise properly, then they are not going to improve. So if you treat their stress, they have energy and desire to work on their problem. As I said, there are different ways of coping with your stress. Some people use some positive ways to overcome the stress. Some people, out of frustration, they use some negative stress. As I said, many people just take some addiction like smoking, drinking, just to relieve the stress. But what do you think? Does it really relieve your stress? If I say yes, if I say no, both is possible. Yes, temporarily, not a permanent solution. But no, because it don't elevate your stressful events, and on a long run, addiction, gradually you develop tolerance to that substance and you are hooked into that addiction, and you require large amount of substance to get that desired effect. So on the long run, using this addictive substance is not at all helpful. It worsens your condition. Many people during stress eat excessively. Exam is खूप खा होते, okay? That is a normal phenomena. But during chronic stage, just they eat and they eat comfort food, not balanced diet. Sugary food they eat just to relieve, increase in the glucose, relieve your stress temporarily. So they use comfort food, junk food, and gradually develop obesity. So one of the cause of obesity is also stress. Because your excess eating, junk food eating, and excessive amount of retention of sodium and water. These are the main causes for stress-induced obesity. Obesity have different causes. One of them is stress. Procrastinating means postponing the thing. So you don't act on that and you just postpone the things and then it worsens your stressful conditions. Withdrawing from friends, family and activity. कशाला बोलायचं कोणाशी किंवा all are just giving a negative remark on me. That might be the stressful event for that person and he just withdraw from everyone. Or because of depression, person start withdrawing from people and so he don't have outlet and stress increases. Many people just don't want to think on stressful event or don't analyze self, where I am wrong, what are my self-talk, whether it is negative or positive. Because this is the main thing, if someone applies, it helps to get out of, get you out of from the stress. Because here your mind or your self-talk is very important to relieve the stress. If you think negatively, you are not going to do some efforts to get out from the stress. But if you think positively, then there is a chance, not you can relieve all stress, but at least there is a chance. So what some people do, स्वतःला खूप जास्त बिझी करून घेतात. ह्याच्यानंतर ते त्याच्यानंतर ते आय डोंट वॉन्ट टाइम टू थिंक. दिवसभरात मी इतकं जमलं पाहिजे की रात्री लगेच झोप लागली पाहिजे. बिकॉज आय डोंट वॉन्ट टू थिंक. त्याचं जे व्हायचं असेल ते होईल. बिकॉज सम सिच्युएशन आर आउट ऑफ देअर कंट्रोल. अँड डिस्प्लेसमेंट ऑफ अँगर. मग अशी म्हटलं तसं वयाचं पहिलं अंगार काढायचं. विच कॉजेस further stress because of impairment in your relationship with other person. So what is stress management? Most of you are knowing. I am not going to give you some big information because all of you are knowing and every one of us usually use some kind or the other kind of coping mechanism which suits us, isn't it? But according to me, the few important things. First, accept that stress is a fact of life and we must learn to deal with it. No person in this world is there that he is not experiencing, he or she is not experiencing stress. Everyone is experiencing stress in some or the other form. But we are the person who, how we take it and how we resolve it. That is all the game over here. So, first would be to identify the stressors. Think, what is the cause for my stress? Try to either eliminate it or try to reduce it. Many times it's not possible to, suppose you have debt for course. It's not possible immediately. But think of it and take some necessary action how you can reduce it. And work on your cognitive errors and emotions. So on these two things, we will talk in some few little details. And another is maintain your stress diary, time management, that all you know. So I won't go in detail about it. So first thing is identify stressor, try to remove or minimize it, accept the reality and try to work in the best possible way. So there are certain techniques you can use like changing the stress producing situations, isn't it? By doing, suppose there is an exam. Very few students, when we were also, we were doing the same thing. Very few students study throughout the year. Most of us, what we have a tendency, exam आले की अभ्यास करायचा. This is one simple example. So many times, if you see, 5% of people, students are, they just don't bother about it. So they don't feel stressful, they don't utilize their resources, they don't perform well, but no anxiety. 5% chunk is there, they study hard, but they have a constant fear. मला जमेल की नाही, होईल की नाही, मी perform करू शकेन की नाही, and it produces excess amount of anxiety, and then excess amount of anxiety produces poor performance. So excessive anxiety, not using your resources properly, and there is a failure. But majority of the chunk utilizes their resources, plan their schedule in best possible way. They try to finish the course, and then they succeed in their exam. Here also, whatever my observation in last 25-30 years, many times people have their own expectation. Just I can give you yesterday's example. One student is coming to me, she's a medical student preparing for NEET. She knows that she is preparing well. She yesterday told me that, Doctor, मला माहिती आहे माझ्या बॅचच्या बाकीच्या मुलांपेक्षा माझा अभ्यास चांगला झाला आहे. बट माझं सगळं वाचून नाही झालं. म्हटलं, you don't need to read everything. You prioritize your things. Whatever the common things are there, first do that. Least common, at least have a look, but don't bother that you should know everything perfectly. Her problem was, she had lots of expectation. मला सगळं आलंच पाहिजे. कुठल्याही गोष्ट सुटता कामा नये. So, what was her cognitive error? मला जर एक गोष्ट मिळाली म्हणजे मला काहीच येत नाही. All or none phenomenon. Or she having a less problem, but she is maximizing it. मला काहीच येत नाही. Then predicting, एक गोष्ट मिळाली म्हणजे मला काहीच येणार नाही. These are various cognitive errors. Personalizing, suppose somebody makes some comment, general comment, but some people take on their own. ते मुद्दाम मला उद्देशूनच बोलले, and then they feel stressful. So there are various cognitive errors in your thought process. So during your stress management, you should keep a diary and list down the events which are causing stress to you. It is different for different people. And then when you are stress free, just review it and then think over it. What are the other alternatives or what are the different other ways that I can handle this situation? So next time when such situation or similar situation happens, you can work on it accordingly. So as I said, changing the stress-producing situation like time management, improving your organization skill, learn problem-solving skill, then changing the physiological response to stress. You all know what happens during stress. So when you are stressful, just make it a habit. Stop, take a deep breath, review the situation and react last, at least postpone your reactions for 1 week or for 1 hour, 1 day, whatever depending upon the situation. Review the situation. So once you have calmed down yourself, you have lots of other options which will help you to reduce your stress. Deep muscle relaxation, also meditation, mindfulness. These are all the techniques which alters your physiological response. So whatever sudden sympathetic overstimulation you experience during stress, that goes down with these techniques. Then de-emphasize stress with distraction. There are good ways of de-stressing and bad ways of de-stressing. Bad ways are using alcohol, tobacco, smoking. These are junk foods. These are the bad way of distressing. What are the good way? Exercise. Why exercise? Because exercise causes dopamine release in your brain. And dopamine is considered as a happy hormone. When there is a dopamine surge, it gives you pleasurable feeling or happy feeling. The same thing happens with alcohol or nicotine also. Smokers say, once I smoke, within a fraction of seconds, I feel relaxed. Many times, alcoholic or those who are consuming alcohol, they say, डॉक्टर खूप छान वाटतं, रिलॅक्स वाटतं म्हणून मी पितो, बाकी मला काही गरज नाही आहे. It depends upon person to person. If that person is from low socioeconomic strata doing laborer work, then they just drink to relieve their physical pain. Those who are doing quite a lot of amount of mental activity, they just drink to keep their mind calm. But it don't elevate your stress. It just blocks it temporarily. Always I give one example to my patients. Suppose you have an injury and you have pain. So what we do first is you use some painkiller like Brufen or Combiflam or something. What it does it improve your inflammation? To some extent, but not. It just blocks your pain perception ability. The same way, any addictive substance block your emotional pain activity for a shorter period of time till you have a that effect on your, or that level is there in your body. So what happens if you use these unhealthy techniques? It won't elevate your stress, but gradually it develops tolerance in the body, and your amount or need to use that substance gradually increases. Nobody drinks alcohol 3 packs or a whole bottle when they use first time, isn't it? Nobody could tolerate. But those who are using it, gradually their amount of requirement has increased because of tolerance. Same way for smoking or tobacco. Just to elevate your stress temporarily they use it. Not all, some use for fun also, but those who are addicted, this is one of the cause. Here also, dopamine surge is there with tobacco or nicotine or alcohol, but it is temporarily. This exercise-induced dopamine surge lasts for a comparatively longer period of time. The same way, if you engage yourself in some hobby, it also gives you pleasure, and that pleasure lasts for a long time. Then attending pleasurable activities, it varies from person to person. In a nutshell, what I want to convey is, here there is an emotional circle. On right side there are positive emotion, on left side there are negative emotions. Have you ever heard anyone stress कमी करण्यासाठी improve your negative emotions? No, because it has stress causing. So if you try to keep your emotion on a positive side of circle, the right side of circle, that are positive emotions, means feeling happy, feeling contented, feeling pleasure, this will help to elevate your stress. So these are the all activities which boost your dopamine level and make you happy. So don't think stress as a threat, as a demoralizer, as a pressure or overwhelming feeling or debilitating, but take it as a challenge, as a motivator, as an opportunity. As I given the example of cafe coffee day person, what he has done, he has used this technique, these feelings, but his wife, he took it as a challenge. Then she had a meeting with her employee, her franchisee people, her investors. Then she made some long-term, short-term and long-term plan, and she started working on it, and gradually she is succeeding. So event was same with both, but taking it in, he had took it in negative form, she has taken in a positive form, and the results are there. Other ways of improving stress is maintaining sleep cycle. It is very important for this young generation, because I think most of the students or most of the people nowadays are sleeping after 2 a.m., 3 a.m., isn't it? Constantly on Insta or constantly on virtual platform. Why it is important? Because our body has natural cycle. So sleep is also having a circadian rhythm. During night, there is a pineal gland which secretes the melatonin, and melatonin helps to improve your sleep quality. If you don't sleep properly, at least for 6 to 8 hours, it varies from person to person. Those who are short sleeper by nature, they require just 6 hours sleep is enough. But those who are long sleeper like me, they require minimum 7 or 8 hours sleep to feel refreshed. Don't think that sleep is a time wasting thing. Sleep re-energize your body and our mind work during your sleep. Whatever happened during the day, it just computer मध्ये तुम्ही सगळं फाईल लिंक करतात ना, the same way our mind works, and during our sleep it does all this work. So if you don't sleep properly, your stressor is going to increase because your body is not resting and your mind is also not resting. So at least have minimum 6 to 8 hours sleep, and it should be in a regular pattern. कधीतरी 10ला झोपायचं, कधीतरी 2ला झोपायचं. Don't do that because it disturb your circadian rhythm and you may face on a long-term sleep disorder issues. Then diet. Diet is also very important, particularly in a female also, because female are very prone for anemia because of dietary deficiencies and because of sometimes loss of blood during menstruation. Female have anemia. In our country, anemia is very common, and particularly in the female. If your hemoglobin level is not normal, then it causes weakness, tiredness, which also adds in your stress level, and it reduces your immunity because your body is not getting sufficient nutrition. Whatever you eat from there, you get carbohydrate, fat, protein, various minerals and various vitamins. These things when get metabolized and absorbed in your blood, they re-energize your cells because tissue loss is constantly there. Wearing and tearing effect is constant in our body. So these all nutrients does that work for regeneration of new cells. And if you don't have proper diet or balanced diet, then long run you have your stress combating ability goes down and you are susceptible for infection. As I told, avoid use of addictive substances, time management, stress diary. Because as I told that maintain your stress diary, list your stress producing event, and when you are at a peace of mind, work on it. And last thing is improve your social support. It is very important because many times if you feel that someone is there to help me in any of my conditions, it gives you very calm effect. And we are a social animal, so we require social support a lot. So in a nutshell, remember that stress cannot be eliminated but only managed. Stress is not due to stressors themselves but due to our reaction to it. Because someone's stress may be the other one's opportunity. Stress management involves changing our way of thinking and perception. Stress management does not imply controlling the pressure but controlling our response to pressure. So use this mindfulness technique. Means if you are emotionally calm, then it reduces your anxiety, it integrates your emotions, it relieves chronic pain, and then your body is at a calm. And lastly, I want to tell you, medical world has lots of research and lots of new things are coming. So don't hesitate to take proper guidance and many times medication to control your stress. As I said, that boy having performance anxiety, or if you don't treat your depression, then your stress is not going to alleviate, because it don't give you that energy or courage to fight it. So there are so many myths about psychiatric disorders. So people feel that psychiatrist कडे जाण्यामध्ये मी काय वेडा झालो का? It's not like that. Those people coming to us, there is an incidence of schizophrenia. So in our local language, when we say it's insane category, it's just 1%. Incidence of bipolar disorder is 1 or 2%. In bipolar disorder, there is a manic depressive episode. But incidence of anxiety and depression is very high. Around 20 to 30% of patients, people are facing anxiety, the same amount with depression. So, and depression is treatable. There is a misconception that once you start taking treatment, you require lifelong treatment. No, it's not true. Particularly in schizophrenic disorder, I agree, yes. Because there are so many neurochemical changes in your brain. It's like a diabetes. In diabetes, what happens? Your insulin level goes down. So insulin is the hormone which controls your blood sugar. If there is no insulin, your blood sugar goes high. So we are giving medication from outside to control your blood sugar level. And once diabetes, if it is stress in diabetes, you can reduce it by various methods. But many patients, 80-90% of patients require lifelong treatment. Same way with the thyroid disorder, same way with the hypertension. Here also in schizophrenia, what happens, there is some neurochemical changes in your brain. So we are giving medication which controls that chemical change and patient shows improvement. In such chunk or particularly bipolar disorder, those having manic depressive episode, here it's just pure biological. Sudden shifts in neurochemical changes, patient may end up in mania or depression. Those people definitely require long-term or sometimes lifelong treatment. But for anxiety or for depression, you may not require lifelong treatment. If it is a biological depression, means because of this bipolar depression, you may require. But if it is external stress-induced depression, you may require short period of time, or because of your personality issues, you may require treatment just to make you perceptible for your change. But here what happens, once patient gets stabilized with medication, then doctor is not going to change it suddenly or stop it suddenly. So लोकांना वाटतं काय डॉक्टर तेच औषध लिहून देतात कशाला जायचं. But as an average, depression episode lasts for 3 to 13 months. It varies from person to person. So what usually do, once you start medication, it will take at least 1 month to show its therapeutic effect. Means paracetamol घेतला आणि 4 तासात ताप गेला, it's not happening over here. Medication starts its full-fledged effect after 1 month of continuous use of medication. And then gradually it subsides your depression, then you need to take maintenance treatment, and then we gradually taper it off. Suppose you had blood pressure and your blood sugar under control. Will you stop it suddenly? What will happen? There is surge of blood pressure, you may end up in heart attack or in paralysis because of sudden high blood pressure. The same way, if you stop any medication which you are taking for a long time, more than 3 months or more than that, then never stop suddenly. Here most of the patients, once they start feeling better, sometimes they stop suddenly. Few people feel relieved, they don't have any episode. But those cycle is lasting for a long time, they have a relapse. Then this vicious circle goes on. So if you take proper treatment under your doctor's guidance, your doctor can stop your treatment. But for this, you require regular follow-ups, which many people are not doing. So if you are not able to cope up with stress, consult your mental health professional for medication and counseling. For stress-induced disorder, many times you require short-term treatment. And the key word is a balance. If you are able to keep your balance in your mind and body, you can win that battle. Thank you.
Thank you, madam. And before going into the question answer sessions, I would like to call upon our chief guest. Please come on the dais. as Madam was talking to us, I was reminded of a Milton's poem in which he says, mind in its own place can create heaven in the hell and hell in the heaven. It's up to us. मराठीत आपण म्हणतो मन करा रे प्रसन्न सर्व सुखाचे कारण. मॅडमच्या लेक्चरमधनं आपल्याला आज मन प्रसन्न ठेवलं तर आपण आपल्या शारीरिक व्याधींवर सुद्धा किती चांगल्या पद्धतीने मात करू शकतो हे कळलं. त्याच्याबद्दल आपण एकदा टाळ्या वाजवून मॅडमचे आभार मानूया. थँक्यू सो मच. May I please now call upon our guest for today's conference session to please come on the dais. Kalkar sir. Let's welcome sir with round of applause once again. Thank you. And please. Before we go back to the session, there is a small announcement. MH12 SCU 0468 venue car. Does it belong to any one of us? It's causing hindrance in the traffic. Could you please move the car? MH12 SU 0468. It's a venue car. It gives me great pleasure to introduce our chief guest for this session today, Dr. Parag Kalkar sir, who is the Dean, Faculty of Commerce and Management at Savitribai Phule, Pune University. Before going to his laurels, I would like to focus on his certain skills. He is an extremely popular teacher with his students, and the skills that he specializes are public speaking, leadership, strategic management, curriculum development, research. So these are the skills that have not only helped sir but also the institution. He had been the rock behind the success story of the Simhagad Institute, where he has been professor and director at the Institute of Simhagad Institute of Management. He is also the deputy registrar at the Simhagad College of Engineering, also a professor and director at the same institute. He is chairman, Board of Studies in Foreign Trade and Management. He is also a Senate member for the same. We are extremely privileged to have him as our guest today. May I request our principal, Dr. Athole Madam, to please welcome and felicitate him. I mentioned the skills before mentioning his laurels because these are the skills that help us go forward and win the world. So this is something we should learn from him. Thank you so much, madam. Thank you, sir. Now, may I request sir to please guide us today. Thank you, sir.
A very good afternoon to all of you. The principal of the college, Dr. Athole Madam, Director of MBA program, Dr. Swati Doshi Madam, who have just delivered the session on stress management and how it needs to be handled. So you have a lot of distraction with your choice. That is the reality. I think the stress management during COVID-19 pandemic, these 2 days national conference organized by Siddhivinayak Mahila Mahavidyalaya Karvanagar and all the students who are present here today. I was patiently listening to Dr. Joshi madam, and she has elaborated scientifically. For me, I think there are three things happens. One is input, process and output. And most of the time, input is not our hand. In our life, from morning to evening, those persons whom we meet or those gathering, who will react in which way, we are not aware. When we check the output is anxiety and output is stress, output is anger, I think we have to go back to check either what is the input or what is the process. And when I am saying that input is not in our hand, so normally what happens at the end of the day, when I am disturbed, when I am angry, when I am anxious, I always blame someone or situation. But I think the process is in our hand. And that I would like to elaborate with an example. I am not a doctor, but I have done my PhD in stress management. So I am not over. But the reason is my subject is teaching subject is finance. But when I thought that the stress is a issue when you go, and it was 20 years back when I thought that it is a very important thing in human life, because at the end, health and happiness, the two is the mission for every human life. So there is an example, there is a pond is there, where very calm, quiet water, where you can see the reflection of sky, blue sky or clouds. Somebody throws something into the pond. The first reaction is a natural reaction where you get waves on the surface. But after a few seconds, after some time, when that pebble goes down and settles down, again that pond surface come into the normal state of mind, which is calm, quiet, and again you can see the reflection. The difference between, I compare it with the human mind. आपलं काय होतं, कोणीतरी काहीतरी बोलतं, त्या क्षणाला आपण डिस्टर्ब होतो. नैसर्गिक आहे, कारण आपण माणूस आहे. म्हणजे आपण काय सिद्धी नाहीये किंवा कोणी काही केलं मग आपण रिॲक्टच होत नाही, मग त्याला टेन्शन येतं. आणि मग तो पुढच्या लेवलने आपल्याला त्रास द्यायला जातो. पण याच्यामध्ये सगळ्यात महत्वाची गोष्ट अशी आहे की जेव्हा जेव्हा आपल्या आयुष्यात दिवसभरात अनेक घटना घडतात, अनेक खडे आपल्या मनावर येऊन आदळतात आणि त्यांनी मनाच्या पटलावर तरंग उमटतात आणि काही काळाने ते घटना, ते क्षण, ते प्रसंग तळाशी जाऊन बसतात आणि मन परत शांत व्हायला पाहिजे. ती प्रसंग घडून गेल्यानंतर सुद्धा, आता मी तुम्हाला सांगितलं मग तुम्हाला सगळ्यांना खरंच कळून येईल बरं का. आपल्या घरात वाक्य आपण असं बोलतो, त्या प्रसंगाला 10 वर्ष झालेले आहेत तरीही त्या प्रसंग जसाचा तसा माझ्या मनामध्ये ताजा आहे. एकदा त्या तलावाला विचलित करणारी घटना घडली किंवा घटनेचा प्रसंग घडणारी व्यक्ती तिथून निघून जाते. आम्ही काय करतो, आमच्या मानसिक प्रक्रियेने जेव्हा जेव्हा आम्ही शांत असतो, जेव्हा जेव्हा त्या प्रसंगाशी निगडीत व्यक्ती, प्रसंग, पात्र काहीतरी आम्हाला आठवतं, तेव्हा तेव्हा आम्ही त्या तळाशी स्वतःहून जातो आणि तो जो साचलेला गाळ आहे ज्याने आम्ही एकदा विचलित झालो होतो तो आम्ही भरभरून वर काढतो. म्हणजे आम्ही आमच्या हाताने त्या तलावाला ढवळतो आणि मग काय होतं, तलावाचं पाणी गढूळ होतं. गढूळ झाल्यावर त्याच्यावरती चंद्राचं रिफ्लेक्शन कसं येणार आहे, गढूळ येणार आहे. आकाश कसं दिसणार आहे, गढूळ दिसणार आहे. रिफ्लेक्शन सगळी गढूळ दिसतात आणि मग आम्ही म्हणतो, आमचा चष्मा बदलतो ना, जगाकडे बघण्याचा आमचा चष्मा बदलतो आणि मग ज्याला मायग्रेन म्हणतात की निगेटिव्हिटी आहे, नैराश्य आहे, काहीच चांगलं होत नाहीये. याच जगामध्ये आता याच हॉलमध्ये अनेक जण खूप आनंदी असतील, सकाळपासून दिवस खूप छान गेला. काही जण वाटत कसं काय आता इथे येऊन बसवलं बरं झालं, आता संपतंय सेमिनार, 20 मिनिटं. बघण्याचा चष्मा प्रत्येकाचा बदलला असतो. त्याच प्रसंगात याच जगामध्ये अनेक सृजन करणारे लोक आहेत. त्यांना नाचावंसं वाटतं, गावंसं वाटतं, त्यांना कविता स्फुरतात, त्यांना काव्य सुचतात, आणि याच जगामध्ये लोक ज्याला त्याच जगाकडे बघायचं. त्यामुळे आपला चष्मा जो आहे तो चष्मा बघायची गरज आहे. आणि नैसर्गिकरित्या एखाद्या प्रसंगातून आयुष्य तुमचं घटना घडणारच ना. आपण कितीही आपलं वाहन चालवत घरापासून महाविद्यालयापर्यंत येत असतो तर मध्ये दगडे खडे येतात, सिग्नल लागतो, कोणीतरी वेडवाकडे येते, सगळं काही आपल्याला ठरलेलं नसतं. प्रत्येक गोष्टीवर जर आपण प्रतिसाद द्यायची प्रतिक्रिया देत बसलो, तुम्ही बघा प्रत्येक माणूस तुम्हाला जर भेटला गाडी चालवताना मध्ये आला, चुकीची चालवत असताना त्याला तुम्ही प्रत्येकाला जर रागवत बसलात, त्याच्याशी वाद घालत बसलात तर काय होईल तेपर्यंत तुमची मानसिक अवस्था पूर्ण तणावपूर्ण होऊन गेलेली असेल. विद्यार्थी म्हणून मला सांगावं असं वाटतं की 15 वर्षाच्या फॉर्मल आपल्या शैक्षणिक विश्वामध्ये 1 वर्ष प्लस मायनस झालं. पूर्वी तर शिक्षकच सांगायचे की याला एक वर्ष रिपीट करा, आणि कधीही विद्यार्थ्याला काही वाटत नव्हतं, पालकांना वाटत नव्हतं. आता एका विषयात नापास झालं तर मुलं चुकीची पावलं उचलतात. कारण तुमच्या यशाच्या आणि अपयशाच्या फुटपट्ट्या कोणीतरी दुसरं जाहिरातीत ठरवत असतं. सगळ्यात पहिलं लक्षात घ्या. The parameters of success and failures are decided at something it is bombarded through most of the media and advertisement. सगळ्यांना 100%च मार्क मिळाले पाहिजे, सगळेजण आपल्या जगामध्ये डॉक्टर किंवा इंजिनियर झाले पाहिजे. सॉरी जनरल सांगतो, पालकांचा जो अट्टास असतो डॉक्टर इंजिनियर झाले पाहिजेत, आपल्याला कवी पाहिजेत, आपल्याला क्रिकेटर पाहिजेत, आपल्याला चांगली माणसं पाहिजेत ना जगामध्ये सगळ्यांनीच एखाद्या. आणि मग त्याच परीक्षा एंट्रन्स टेस्ट तुम्ही पाहिलं की त्याच्यामध्ये ती मुलं जातात. एमपीएससी युपीएससी सध्या चाललेले आहे सगळे. प्रत्येकाला वाटतं आपल्याला आयएस झालं पाहिजे. जागा 500 आणि 50 लाख मुलं प्रयत्न करतायत. प्रेशर. साधी सोपी गोष्ट आहे. प्रत्येक जण जन्माला येताना काहीतरी स्किल सेट्स घेऊन आलाय, ज्याला मी बीज म्हणतो. ते आंब्याचं बीज असू शकतं, ते सीताफळाचं बीज असू शकतं, ते नारळाचं बीज असू शकतं. त्या बीजाचं चांगल्या वृक्षामध्ये रूपांतरण होण्यासाठी एक विशिष्ट प्रकारची प्रक्रिया, त्याला विशिष्ट प्रकारचं सहकार्य लागतं, आणि तोच तुमचा आमचा आणि शिक्षणाचा रोल आहे. मला असं वाटतं माझ्या घरात जे बीज जन्माला आलेलं आहे, माझा मुलगा किंवा मुलगी म्हणून, त्यांनी आंब्याचं झाड झालं पाहिजे. आपली किती पैसे खर्च करायचे पालकांची मानसिकता सांगतो. आज सगळं काय होतं, मग मी त्याला काय होतो की आंब्याच्या झाडाला जे योग्य आहे ते सगळे क्लासेस लावतो. आंब्याच्या झाडाला जे आंबे यायला लागतात ती सगळी खतं घालतो, आणि त्याला सारखं दाखवतो की तुला यासारखं व्हायचंय, आंब्यासारखं व्हायचंय. तो जे बीज घ्या जन्माला गेला त्याचा जर वृक्ष झाला नाही, मग त्याला आंबे येतात का? येऊ शकत नाही. का ते स्किल सेट घेऊन तो जन्माला आलेला नाहीये. आपण मनुष्य म्हणून जन्माला आलोय. मी कितीही तुम्हाला उडण्याचे क्लासेस दाखवले तरी तुम्ही उडू शकणार आहे का? हेच आपण करतो व्यवहारात. आपण आता हसतोय. आपण घरात बघा कंपॅरिझन का करतात पालक आपल्या पाल्याची दुसऱ्या पाल्यांबरोबर? कारण प्रत्येक बीज वेगळं जन्माला आलंय. नाही तर मग मशीन मध्येच क्लोन माणसं काढली नसती का? ते जे बीज, ते जे स्किल्स मलाही कळत नाहीत. आज आम्ही ज्या महापुरुषांचा आदर्श घेतो जगामध्ये, कुठल्याही जगातले कुठले असू दे, ती ज्ञानेश्वर महाराज असू दे, शिवाजी महाराज असू दे, कोणीचे असो, त्यांना ते कुठलं बीज जन्माला घेऊन आले ते त्यांना त्यांच्या 6व्या-7व्या वर्षीच कळलं होतं. आज 12 वर्षाच्या मुलाला आमच्या घरातले लोक सांगतात तुला काही कळत नाही. मी सांगतो ते आणि त्यामुळे त्याला जे योग्य आहे. मग काय होतं त्याला की तो जे घेऊन जन्माला आलाय, समजा ते नारळाचं झाड म्हणून व्हायला जन्म असेल, ते बीज नारळाच्या झाडाचं असेल, ते पालकही ओळखत नाही कारण त्यांच्या डोळ्यासमोर झापड असते, कारण शेजारी आंब्याचं झाड असतं. बरोबर आहे ना? त्यामुळे काही झालं तरी आंब्याचं झाडच झालं पाहिजे असं त्यांचा अट्टास असतो. ती सगळी प्रक्रिया केल्यानंतर काय होतं, त्याचं नारळाचं झाड होत नाही कारण चुकीची ट्रीटमेंट दिली जाते, चुकीचा प्रेशर त्याला क्रिएट केलं जातं आणि आंब्याचं व्हायचा प्रश्नच उद्भवत नाही. आणि मग त्या मुलाला आपण अपयशी ठरवतो. त्या मुलाला आपण एक वेगळा शिक्का मारतो की तू काही करू शकत नाही, तू माझी मान खाली घालायला लावली, मला समाजात तोंड दाखवायला जागा ठेवली नाही. कंपॅरिझन करायची गरज नाही. एव्हरी इंडिव्हिज्युअल इज अ परफेक्ट पर्सन, इट्स रिक्वायर्ड फॉर दिस अर्थ. तुम्ही जेव्हा जन्माला आलाय तेव्हा त्या जगाच्या कुठल्या तरी कानाकोपऱ्यात तुमच्यासाठी काही छान विश्व ठेवलेलं आहे. फक्त ते आम्हालाही कधी सापडत नाही, कारण आम्ही कायम तुलना करत असतो, यशाची आणि अपयशाची सुद्धा. अपयश हा जगण्याचा पार्ट आहे. त्याला अपयश असं सुद्धा तुम्ही म्हटलं तरी ते चुकीचं आहे. त्यामुळे इनपुट आमच्या हातात नाहीये. कोण आज येऊन माझ्याशी काय बोलणार आहे मला माहित नाहीये, पण ती प्रक्रिया माझ्या लक्षात आहे ना. त्या प्रक्रियेवर पहिला प्रतिसाद जो आहे तो नैसर्गिक असू शकतो, मला त्रास होऊ शकतो, त्या क्षणाला मला वाईट वाटू शकतं, त्या क्षणाने माझं मन विचलित होऊ शकतं, पण एकदा तो प्रसंग तळाशी जाऊन बसल्यानंतर परत त्याच्या मागे जायचं काय कारण आहे? आज एखाद्या व्यक्तीने माझा अपमान केला किंवा एखादी व्यक्ती माझ्याशी वाईट बोलली, तर ती व्यक्ती जेव्हा मला दिसते दुरून माझ्या मनात लगेच प्लेबॅक. कदाचित ती व्यक्ती माझी क्षमा मागायला येत असते, पण माझ्या मनाची तयारीच नसते, कारण मला तोच प्रसंग माझ्या मनामध्ये ना. आपण घरामध्ये संवाद ऐकतो, सासू सुनेचे संवाद आपल्याकडे फेमस आहेत, की लग्नाच्या वेळेला 30 वर्षापूर्वी काय घडलं असतं, कोणाला काय द्यायचं राहिलं, कोणी कोणाचे नमस्कार केला नाही, हे 30 वर्षानंतर सुद्धा दोघींना आठवलं. मुली आहेत, महिला आहेत म्हणून मी ते उदाहरण दिलं, बाकी काय सगळ्यांचंच असतं, पण महिलांकडे हा प्रवास जास्त आहे. माझ्या मते आपण दिवसात यादी काढली की आपल्या जीवनातले सगळ्यात आनंदाचे 10 प्रसंग आठवा आणि सगळ्यात त्रास देणारे 10 प्रसंग आठवा, तर आपल्याला कुठले प्रसंग पटकन आठवतात आणि संख्यात्मक केली तर आपल्या लक्षात येईल की आपण काय स्टोअर करतो. आणि म्हणजे स्टोअर करतो तर त्रास होणारच आहे. नकारात्मक गोष्टी आपण मनामध्ये जर स्टोअर करून ठेवल्या असतील आणि ते सारख्या मनातनं बाहेर काढून त्याची प्रक्रिया करत असते, ढवळत असतो, किती वेळा ढवळल्याने त्यातला प्रसंग जाणार आहे का? तो प्रसंग होऊन गेलाय ना. समजा तो वाईट असेल, चुकीचा घडला असेल, घडायला नको होतं, सगळं मान्य, ते सगळ्यांना पडतं, पण तो प्रसंग आपण विसरत नाही. परमेश्वराने आपल्याला विसरायची सुंदर गिफ्ट दिलेली आहे, पण चांगले प्रसंग, सकारात्मक प्रसंग आपण विसरतो आणि वाईट प्रसंग आपण जास्त काळ लक्षात ठेवतो आणि त्यामुळे आपल्या आयुष्यामध्ये तणाव निर्माण होतो. आयुष्य खूप सुंदर आहे आणि शिक्षण हे सर्वस्व नाहीये. शिक्षण ही एक प्रक्रिया आहे, एखाद्या गोष्टीकडे बघायची, जीवनाला दृष्टिकोन चांगला प्राप्त करून द्यायची. आपण एकत्र येतो शिक्षणाच्या निमित्ताने आणि त्या निमित्ताने आपल्याला अनेक गोष्टी कळतात, समजतात, आपलं जीवन कळतंय. पाहावे आपण असे आपण या नावात ज्ञान. शेवटी आपण काय आहे हे समजणं हेच शिक्षणाचं उद्दिष्ट आहे, त्याच्यातनं आपली वाट काढायची आहे. आणि म्हणून आपण जी प्रणाली आता बदलतोय पुढच्या काळामध्ये, ज्याला चॉईस बेस्ड क्रेडिट सिस्टीम म्हणतो, सगळ्यांना आपण मशीन प्रमाणे करायचं नाहीये. सगळ्या विद्यार्थ्यांना बीकॉम एमकॉम असं मशीन प्रमाणे घडवायचं नाही, तर प्रत्येक विद्यार्थी वेगळा घडला पाहिजे. आणि आज इंडस्ट्री ते करते. म्हणजे मी गमतीने परवा दिवशी एका ठिकाणी लिहिलं होतं की मशीन माणूस बनवण्याचा प्रयत्न करते, त्याला आर्टिफिशियल इंटेलिजन्स म्हणतो, की काय म्हणतो मशीन लर्निंग म्हणतो, की माणसासारखं वागायचे प्रयत्न करते, अलेक्सा आणि कोण कोण, आणि माणूस मशीन बनण्याचा प्रयत्न करतोय वेगवेगळ्या गोष्टी शिकून. त्यामुळे हे सगळ्या गोष्टी लक्षात घेताना तुमच्या लक्षात आलं पाहिजे की आपल्याला काय करायचंय, आपले उद्दिष्ट काय, आपल्याकडे काय स्किल्स चांगले आहेत. प्रत्येकात 1 2 3 4 स्ट्रॉंग स्किल्स आहेत, ते जेवढ्या लवकर तुम्हाला कळतील आणि त्याच्यात ती योग्य असणाऱ्या जीवनशैली तुम्हाला निवडा. आता मला क्रिकेट आवडतं, मी क्रिकेट करिअर म्हणून घेतलं, हॅपीनेस आहे की नाही? नाही तर मी पाहिलं डॉक्टर लोक सुद्धा अँकरिंग करतात टीव्हीवरती. कारण काय झालं, परिस्थितीने त्यांना डॉक्टर व्हायला लागला, त्यांचा तो पिंडच नव्हता, पण त्याचा मूळ पिंड काय होता, अँकरिंग होता. आता अँकरिंग मध्ये हॅपी आहेत की नाही? हॅपी आहेत. त्यांना जर आपण कंपल्सरी प्रॅक्टिस करायला लावलं असतं तर त्यांनी ते आनंदी झाले नसते. त्यामुळे आपल्या या सगळ्या रचनेमध्ये प्रत्येक विद्यार्थ्यांनी लक्षात घ्यायला पाहिजे की काहीतरी गुण मी घेऊन जन्मला. आणि कुठलाही व्यवसाय हा कमी दर्जाचा नाही. आज एक चांगली कलाकृती निर्माण करणे, आज चांगलं संगीत निर्माण करणे, आपण पाहिलं पु ल देशपांडे आहेत, अनेक संगीतकार आहेत, भीमसेन जोशी सारखे आहेत, की जे 100 वर्ष 1000 वर्ष जगाला पुरेल असं काही ज्ञान, असं काही ताकदीचं संगीत किंवा ज्याला पुस्तकी ज्ञान देऊन गेलेले आहेत. ते आहेत की नाही? समाजाला आवश्यक आहेत की नाही? संगीतकार, चित्रकार आवश्यक आहे, कला आवश्यक आहे, क्रीडा आवश्यक आहे, स्पोर्ट्स मध्ये लोक पुढे आली पाहिजेत, इनोव्हेशन थिंक मध्ये पुढे आली पाहिजे. त्यामुळे अनेक फील्ड आहेत. कुठेही असं नाही की सगळ्यांनी एकाच प्रकारचं शिक्षण घेतलं पाहिजे. म्हणून आपण चॉईस बेस्ड क्रेडिट सिस्टीम मध्ये जातोय की 60% कोर घेतलं पाहिजे आणि 40% तुम्हाला काही घेता येतं. तुम्हाला योगा शिकायचं, मेडिटेशन शिकायचं, तुम्हाला सायकोलॉजी शिकायची, सगळ्या गोष्टी आवश्यक आहेत, ज्याला सर्व समावेशक शिक्षण आपण असं म्हणतो. आपलं शिक्षण यापूर्वी एककल्ली होतं ना, आता तर आपण सर्व समावेशकतेकडे चाललोय. सायकोलॉजीचं ज्ञान असलं पाहिजे. मॅडमने सांगितलं 95% माझ्या अभ्यासाप्रमाणे सगळे जे शारीरिक रोग आहेत ते पहिले मानसिक स्तरावर क्रिएट होतात. सायकोसोमॅटिक रिलेटेड डिसीजेस ज्याला म्हणतो. माझी मनाची प्रक्रिया पहिले बिघडते आणि मग शरीरावर परिणाम दिसतो, त्याला आपण ब्लड प्रेशर म्हणतो. माझी मनाची प्रक्रिया पहिले बिघडते आणि मग शरीरावर परिणाम दिसतो, त्याला आपण ब्लड शुगर म्हणतो. त्यामुळे मग 105 मनाचे श्लोक रामदास स्वामींनी लिहिले ना. किती छोट्या गोष्टीपासून मोठ्या गोष्टीपर्यंत आपलं मन व्यापक करणं पाहिजे ते लिहिलंय. मनासी टाकिले मागे गतीशी तुलना नसे, अणुपासून ब्रह्मांड एवढा होत जात असे. किंवा बहिणा म्हण वढाय वढाय उभ्या पिकातलं डोरं, किती हाकला हाकला फिरी येतं पिकावर. ते सगळं लिहिलेलं आहे. याच्यामध्ये फक्त म्हणतो आपल्याकडे सगळे मॅडम सांगितलं अगदी 200% मान्य आहे. मनाला आपल्याला रोग झाला आहे किंवा मनाला आपल्याला दोष निर्माण झाला हे आम्ही मान्यच करत नाही, कारण आम्हाला फक्त माहिती की तो माणूस फक्त वेडा असतो आणि तेव्हा त्याला ट्रीटमेंट आम्ही देतच नाही. जसं आपण ताप आला, डोकं दुखलं, काही व्याधी झाल्या म्हणून डॉक्टरकडे जातो, तसं आपल्या मनाच्या प्रोसेसरमध्ये जर काही फरक झाला असेल, काही दोष निर्माण झाला असेल तर त्या वेळी किती योग्य ट्रीटमेंट घेतली पाहिजे. त्याला मेडिटेशन आहे, योगा आहे, स्पोर्ट्स आहे आणि डॉक्टर्स आहेत, अशा अनेक प्रकारच्या ट्रीटमेंट घेता आले पाहिजे. ते दुरुस्ती करता आली पाहिजे. अनेक वेळा आपली मनामध्ये घरात घटना घडतात. कोविडचा पिरियडमध्ये आपल्याला अनेक गोष्टी पाहिल्या. टीव्हीवर इतक्या वाईट गोष्टी दाखवल्या जातात की घरातून बाहेर पडलो की यमराज उभा, इतकी वाईट दाखवलं आजही दाखवलं जात. हा व्हेरियंट आला, तो व्हेरियंट आला, इतके लोक, म्हणजे तुम्ही सगळ्या बातम्या पाहिल्यावर आपण डिप्रेशन मध्ये नॅचरली जातो. कंपॅरेटिव्ह डिप्रेशन मध्ये जातो किंवा डिप्रेशन मध्ये जातो. तर हे सगळं कुठेतरी आपल्याला थांबवलं पाहिजे आणि चुकीच्या गोष्टी आमच्या मनावर सातत्याने बिंबवल्या जातात. त्या दृष्टिकोनातनं आपण सगळ्यांनी सक्षम झालं पाहिजे. आपण सगळ्यांनी विचार केला पाहिजे. बेसिकली आजच्या तरुणांनी की कुठलंही क्षेत्र वाईट नाहीये, प्रत्येक जणांकडे 100% चांगले गुण आहेत, ते स्वतःला ओळखता आले पाहिजे, त्याचा विकास करता आला पाहिजे. सगळ्यात महत्वाचं आहे. अनेक गोष्टी, अनेक संधी आहेत, कुठेही अशी अडचण नाही की नोकऱ्या गेल्या आहेत. हे सगळे आपण स्टॅटिस्टिक वाचतो. आज कॉमर्समध्ये, पुण्यामध्ये, येरवड्यामध्ये माझ्याकडे 4000 जॉब्स बीकॉम पासआउट स्टुडंटला अवेलेबल आहेत. आज आतापर्यंत 400 रिक्रुटमेंट झाली फक्त. अजून त्याला 3600 मुलांची कमी आहे. 10 ते 15 हजार रुपये फ्रेश कॉमर्स ग्रॅज्युएटला नोकऱ्या आहेत. संधी भरपूर उपलब्ध होत आहेत. फक्त त्यापर्यंत आपल्याला जायला पाहिजे. कारण नसताना आपण चुकीच्या गोष्टी मनामध्ये घेऊन जातो आणि म्हणून आपण बीकॉमच्या सुद्धा शेवटच्या वर्षाला आपण म्हणलं थोड्या प्रमाणात आपण इंटर्नशिप आणली 60 तासाची. कदाचित पुढच्या काळामध्ये आपल्याला ती 1 सेमिस्टर पर्यंत मोठी न्यायची आहे. कारण जे अकाउंट आपण शिकतो, जे आपण डेबिट क्रेडिट शिकतो, जे आपण सगळे व्यवहार शिकतो, ते व्यवहार प्रत्यक्षात कसे होतात ह्याचा जोपर्यंत आपल्याला जाणीवा होत नाही की बँकेत हे कसं ठेवलं जातं, तोपर्यंत आपल्याला कळणार नाहीये. त्यामुळे या शिक्षणाचा व्यवहार करायचं काय हे कळण्यासाठी आपल्याला इंटर्नशिप आवश्यक आहे. त्यामुळे ही शिक्षणाची प्रक्रिया तुम्ही पाहिलं असेल की आज विद्यार्थी वर्गामध्ये बसण्यापेक्षा कॅन्टीन मध्ये बसायला जास्त प्रिफर करतात. स्टेअरकेसवर बसतात. किती खराब असल्यात, किती तुम्ही एअर कंडिशन वर्ग असले तरी पायऱ्यांवर बसायला का आवडतं, तर पायऱ्यांवर तुमचं माइंड ओपन होतं. आज वर्गाच्या सुद्धा संकल्पना आमच्या बदलल्या पाहिजेत. तुम्हाला मॉलमध्ये जाऊन वर्ग घेता आला पाहिजे का, तिथं व्यवहार कसं चालला हे कळलं पाहिजे. तुम्हाला बागेत बसून शिकवता आलं पाहिजे. आपल्या डोक्यात वर्ग म्हणजे 4 खोल्या, भिंत, शिक्षक, फळा, खडू आणि विद्यार्थी. हे न करता त्याच्या बाहेर सुद्धा खूप शिकण्यासारखं आहे. त्यामुळे आपण ज्याला म्हणतो की फील्ड वर्क जाऊन शिकलं पाहिजे. आपण प्रॅक्टिकल शिक्षण दिलं पाहिजे आपल्या लोकांना. प्रोजेक्ट बेस्ड लर्निंग म्हणतो त्याला. प्रॉब्लेम बेस्ड लर्निंग. हा प्रश्न आहे कसा सोडवायचा, तुम्ही उत्तर द्या. विद्यार्थ्यांची मानसिक इन्व्हॉल्वमेंट झाली होती. जे पुस्तकात होतं ते विद्यार्थ्यांनी तसं उतरवलं तर तो पास, नाही उतरवलं तर नापास. काय करायचं, आपल्याकडे एवढी झेरॉक्स मशीन आहेत, 8 TBच्या हार्ड डिस्क मिळत होतं बाजारामध्ये 4000 रुपयामध्ये. मग माझ्या मेंदूत सगळा कचरा कशाला भरायचा. बरं, ती डेफिनेशन सगळ्यांनी पाठ केल्याने माझ्या जगामध्ये, माझ्या आयुष्यात काय फरक पडणार आहे. आपण सगळ्यांची 100% डेफिनेशन पाठ झाली आणि आपल्याला सगळ्यांनी त्या डेफिनेशन लिहून 100 पैकी 100 मार्क पडले. मग करायचं काय सांगा मला. शिक्षण म्हणून काय करायचं, तर त्याचं ऍप्लिकेशन कसं होऊ शकतं. आत्ताच्या जगामध्ये त्याचं ऍप्लिकेशन कुठे कुठे होतं आणि कशा तऱ्हेने केलं जातं हे जर आम्हाला व्यवहारात कळलं, जे आम्ही शिकतो ते. म्हणून आज UGCने सांगितलंय कंटेंट कमी करा, सिलेबस छोटा द्या, फक्त त्याचं व्यवहारात ऍप्लिकेशन कसं करायचं हे विद्यार्थ्यांना प्रत्यक्ष बाजारात जाऊन शिकवलं पाहिजे. विद्यार्थ्यांना कळलं पाहिजे कसं वापरायचं. आणि शिक्षण हे आनंदाशी आहे मित्रांनो. आज काय होतं, परीक्षेचं टाइम टेबल आलं की माझ्याकडे स्ट्रेस वाढतो. मला एक छोटं उदाहरण सांगतो थांबण्यापूर्वी, कारण मी शिक्षक असल्यामुळे तासभर बोलू शकतो. मॅडमला लागलं बेल वाजवण्याची वेळ येऊ नये. गंमत म्हणून सांगतो, तुम्हाला लक्षात घ्या बरं. आता आपलं तुम्ही कॉमर्सची मुलं आहात, साधारण आपलं 14-15 वर्षाचं फॉर्मल शिक्षण झालं, बरोबर आहे नाही? पहिली 4-5 वर्ष सोडून द्या, पहिली ते 5वी आपल्याला फार त्या काळात कळत होतं किंवा नव्हतं कळत असं म्हणू शकतो आपण. पण एक लक्षात घ्या की या सगळ्या 15 वर्षाच्या आयुष्यातले पहिले 2-3 वर्ष काढले तर साधारण 12-13 वर्षाचं शिक्षण आहे की ते आपण सजगपणे केलं. तुम्हाला सगळ्यांना माहिती की प्रत्येक ज्याला शैक्षणिक वर्षी आपलं कॉलेज शाळा जे काय असेल ते साधारण जून आणि जुलैमध्ये चालू होतं, बरोबर आहे ना? 5 जूनला शाळा चालू होते आणि कॉलेज साधारण 1 जुलैला चालू होतं. अलीकडे पलीकडे एक हाताकडे सगळ्यांना माहिती आहे. त्याच्यानंतर त्या वर्षभर आता सेमिस्टर सिस्टीम आली, पण यापूर्वी आपल्याकडे वर्षाच्या शेवटी परीक्षा व्हायच्या, बरोबर आहे की नाही? मग त्या सगळ्या वर्षभरामध्ये आपल्याला काय शिकायचं याची पुस्तकं आपल्याला माहिती होती, विषय माहिती होते. जून मध्ये आपल्याला माहिती होते की नाही? ते शैक्षणिक वर्ष सुरू होण्यापूर्वी 1ली ते 5वी 10वी 11वी 12वी FY SY आपल्याला माहिती होतं जून मध्ये शैक्षणिक वर्ष सुरू होण्यापूर्वी की आपल्याला कुठले विषय शिकायचे त्या वर्षभरामध्ये, त्या विषयांची पुस्तकं आहेत ते आपल्याला माहिती होतं. त्याच्यानंतर त्या विषयामध्ये आपली परीक्षा साधारण कधी होणार आपल्याला माहिती होतं, मार्च किंवा एप्रिल, एक आठवडा इकडे तिकडे. त्याच्यामध्ये साधारण काय प्रश्न आपल्याला विचारू शकतात हेही आपल्याला माहिती होतं. जून मध्ये माहिती होतं की नाही? मागच्या 3 वर्षाचे पेपर पाहिले की कळतं काय विचारतात त्याच्यामध्ये साधारणतः, आणि त्याची उत्तरं काय हेही माहिती होतं. 21 अपेक्षित म्हणजे वर्ष सुरुवातीला आपल्याला अकॅडमिक इयर सुरू होण्यापूर्वी मला विषय माहिती होते, त्याचे कंटेंट माहिती होते, त्याची पुस्तकं माहिती होती, त्याची प्रॉबेबल परीक्षेची तारीख माहिती होती, प्रॉबेबल प्रश्न माहिती होते आणि प्रॉबेबल उत्तर माहिती होती. बघा आता माझ्या प्रश्नाचा पुढचा रोग सगळ्यांनी प्रामाणिकपणे उत्तर द्यायचं. एकदा तरी असं झालंय का की या सगळ्या मागच्या 12-13 वर्षामध्ये परीक्षेच्या हॉलमध्ये एंटर करण्यापूर्वी तुम्ही अशा ठाम मतावर आहेत की या विषयातलं मला काहीही वाचण्याचं राहिलेलं नाही? वर्षभरापूर्वी तुम्हाला माहिती होतं. कसं असतं, माझी प्रेरणा चांगला अभ्यास करायला पाहिजे, भरपूर अभ्यास करायला पाहिजे, पुढच्या वर्षी चांगले मार्क पडायला पाहिजे, ही जी प्रेरणा एकदम स्ट्रॉंग केव्हा होते माझी? जेव्हा रिझल्ट हातात पडतो तेव्हा सगळं माझं ठरलेलं असतं की पुढच्या वर्षी काय करणार, मी सकाळी 5 वाजता उठणार किंवा रात्री जागणार वगैरे वगैरे हे सगळं. पण ती प्रेरणा हळूहळू काळाच्या बद्दल वीक होते. त्याच्यानंतर 2 महिन्याने आमचं शैक्षणिक वर्ष सुरू होतं आणि तेव्हा आम्ही विसरून गेलेला असतो आणि आम्ही केव्हा जागे होतो सगळे मिळून. सगळे मी पण त्याच्यात आहे, असं काही नाही मी तुमच्यासाठी बोलतोय. आपल्याला जाग केव्हा येते? जेव्हा परीक्षेचं वेळापत्रक जेव्हा नोटीस बोर्ड लागतं तेव्हा आपण पेपर शोधायला लागतो, पुस्तकं शोधायला लागतो आणि मग आपल्याला वाटतं की अरे हा अभ्यास करायला पाहिजे, तो अभ्यास करायला पाहिजे, मग एकमेकांना विचारायला लागतो. त्यामुळे मग काय होतं, आपल्या आयुष्यात ताण निर्माण होतो. आज आपण शिक्षण आणखी सोपं करतोय की विषय समजला पाहिजे, फक्त त्याचं आकलन झालं पाहिजे. आपल्याकडे माहिती आहे आणि माहिती आज गुगलला गेलं तुम्ही सगळे अवेलेबल आहे. पण त्या माहितीचं करायचं काय? माझ्या आयुष्यामध्ये त्या माहितीचा काय उपयोग आहे याची जाणीव जेव्हा होईल. अदरवाईज गुगलवर सगळंच आहे ना, आपण वर्गात काय येतो शिकतो का, आपण त्या इन्फॉर्मेशनचं काय करायचं हे आपल्याला कळलं पाहिजे. शेवटी मी फक्त औरंगाबादच्या एका विद्यार्थ्याचं उदाहरण देतो. आज शिक्षकांना काय पर्याय नाही. पूर्वीच्या काळी जी आपल्याकडे पद्धत होती, गुरुकुल पद्धत होती, ती का महत्वाची होती? तर गुरुकुल पद्धतीमध्ये शिक्षकाच्या घरी आपण जाऊन राहत होतो आणि किमान 6 महिने वर्षभर गेल्यानंतर मग ते शिकवायला सुरुवात करत होते, कारण त्या वर्षभरामध्ये तुमची जीवनमूल्य ते तपासत होते आणि जीवनमूल्य तपासल्यानंतर तुम्हाला कुठलं शिक्षण योग्य आहे हे ते द्यायला सुरुवात करत होते. कदाचित त्याचा सिलेबस नव्हता. भीमसेन जोशींनी लिहिले, त्यांचे जे शिक्षकांकडे ते गेले होते, 1 वर्षभर फक्त कावड भरून पाणी आणणे आणि गुरुचे कपडे धुणे नदीवर जाऊन, एवढं एकच काम त्यांना वर्षभर करायला लावलं. त्याच्या वडिलांनी कळले की फी घेऊन आपल्याला मुलाला कष्ट कसे करायला लागतात. आजकाल ते पालक उपोषणाला बसले. पण 1 वर्षानंतर त्यांना दुसरी साधना दिली करायला की एक सूर घ्यायचा आणि तेलाचा दिवा समोर लावायचा आणि ते साधारण तेल संपेपर्यंत तोच सूर म्हणत राहायचं 3-3.5 तास. आणि ही साधना जेव्हा त्यांच्याकडे केली तेव्हा आज तुम्ही पाहता की भीमसेन जोशीच्या आवाजाची जी ताकद आपण आणतो की न भूतो न भविष्यती. पण हे गुरुला काय, प्रत्येक जण आधी मला लिहून द्या, सिलेबस द्या, मग तो सिलेबस अप्रूव्ह केला की नाही बघा, मग एवढंच का तेवढंच का, मग यावेळी सिलेबस मध्ये कमी करणार नाही का, त्याला बरं नाही, हे असं काही नव्हतं. कारण शिक्षकावर पूर्ण विश्वास होता. आज काय झालं, आपण शिक्षकावर विश्वास ठेवत नाही यार. आम्हाला वाटतं आम्हाला गुगलमध्ये सगळं युट्यूबवर मिळू शकतं. औरंगाबाद मधल्या एका विद्यार्थ्यांनी युट्यूब बघून एक बॉम्ब बनवला इंजिनिअरिंगच्या विद्यार्थ्यांनी आणि बॉम्ब बनवल्यानंतर त्याच्या लक्षात आलं की याचा बॉम्बचं डिफ्यूज कसं करायचं आपल्याला माहित नाही. आणि मग तो त्यांनी नेऊन एका बस स्टॉपवर टाकला आणि तो पोलीस चौकीला गेला. प्रामाणिक विद्यार्थी होता आपल्यासारखा. आणि त्यांनी सांगितलं की अशा ठिकाणी बॉम्ब सदृश वस्तू मला दिसली आहे, तर ती घ्यावी. पोलीस आले, त्यांनी ती डिफ्यूज केली वगैरे सगळं झालं. पण सीसीटीव्ही फुटेजमध्ये दिसलं की तक्रार देणारा विद्यार्थी आणि ते ठेवणारा विद्यार्थी एकच आहे. आणि त्यानंतर त्याची जेव्हा चौकशी केली तेव्हा त्या लक्षात आलं की ते गुगलवर कुठेतरी त्यांनी शोधून काढलं सर्चमध्ये आणि त्याच्यातून त्यांनी शिकलं. आज जे ज्ञान आम्हाला मिळतंय, आज आपण पाहिलं सायबर क्राईम खूप मोठ्या प्रमाणावर वाढतोय. कारण ते शिकणाऱ्या विद्यार्थ्यांना त्यांची प्री क्वालिफिकेशन बघितली जात नाही. त्यामुळे तुम्ही स्टॅनफोर्ड, ऑक्सफोर्ड, जगातली सगळी विद्यार्थी आता म्हणतायत 20% डोमेन नॉलेज पाहिजे, 80% हे व्हॅल्यू एज्युकेशन असलं पाहिजे. कारण त्याचं काय करायचं हे त्याला कळलं पाहिजे. तुम्हाला समजा शस्त्र चालवण्याचं ज्ञान दिलं तर ते शस्त्र कुठे केव्हा तुम्ही पाहिलं असेल, रामायण महाभारत आपल्या सगळ्या याच्यामध्ये निशस्त्र लोकांवर हात चालवत नव्हते, स्वतःपेक्षा वीक असलेल्या माणसावर चालवत नव्हते, संध्याकाळ नंतर सूर्यास्तानंतर शस्त्र चालवत नव्हते. अनेक व्हॅल्यूज त्याच्या होत्या, म्हणून ते युद्ध आपल्या लक्षात राहतं. आपण आज व्हॅल्यू पाळत नाही त्याच्यामध्ये. त्यामुळे हे विद्यार्थी काय करतात, सायबर क्राईम कडे आज वेगवेगळ्या तरुण वळतायत. चुकीचा वापर केला जातो, फेसबुकचा चुकीचा वापर केला जातो. जे आहे त्याचा सगळा चुकीच्या गोष्टी फॉरवर्ड केल्या जातात. हे का केलं तर ते कसं वापरायचं आणि कुठे वापरायचं याच्या मर्यादा आम्हाला घालून देणारे फक्त आमचे शिक्षक असू शकतात. त्यामुळे ज्ञान सगळ्यांसाठी उपलब्ध आहे, सगळ्यांना अवेलेबल आहे. फक्त ते ज्ञान प्रत्येकाच्या क्षमता असतात, त्या क्षमतेप्रमाणे त्याला दिलं गेलं पाहिजे आणि त्याचा वापर व्यवहारात कसा करायचा हे सुद्धा ते सांगणारे फक्त शिक्षकच असू शकतात. तुम्हाला मशीन सांगू शकत नाही. त्यामुळे माहिती तुम्हाला सगळी मिळू शकते, युट्यूब बघून तुम्हाला सगळं जगाचं कळू शकतं, पण त्याचा व्यवहारात उपयोग काय करायचा आणि माझ्या क्षमतेशी काय निगडित आहे ते फक्त तुम्हाला तुमच्या वर्गातले शिक्षक सांगू शकतात, तुमच्या घरातले लोक सांगू शकतात, तुमचे आई वडील सांगू शकतात. कारण तुमच्या घरात तुमच्याबद्दल एक फिक्स मत ठरलेलं आहे. बघा बरं, याला किती वेळा सांगा हा ऐकत नाही. याला कुठलंही काम दिलं तर ते काम होण्याची शक्यता मी काही सांगत नाही. तुमच्या जवळनं ओळखणारे घरचे लोक असतात, त्यामुळे घरात कुठलाही कार्यक्रम ठरला तरी तुम्हाला काय रोल द्यायचा की नाही हे आधी ठरतं. की त्याला 4 वेळा 5 वेळा सांगा. त्याला कुठलंही काम देऊन बाजारात पाठवलं तो कंदळ 100% गोंधळ करण्याची शक्यता आहे. त्यामुळे जवळचे लोक आपल्याला चांगले ओळखतात, त्यातून आपल्याला आपल्या व्यक्तिमत्वाबद्दल कळलं पाहिजे आणि त्यातले जे दोष आहेत ते दूर करता आले पाहिजे. सगळ्यांचं आयुष्य छान यशस्वी होणार आहे. या जगामध्ये ज्या गोष्टी अनावश्यक आहेत त्या भूतलावरून आपोआप नष्ट होत असतात. डायनासोर सुद्धा नष्ट झाले जेव्हा त्यांचा या जगावरचा उपयोग संपला. त्यामुळे आपण आहोत, त्यामुळे आपल्याला काय खूप छान चांगलं करायला मिळणार आहे. चांगल्या संस्थेमध्ये आपण शिक्षण घेतो आहोत, चांगली मूल्य आपण जोपासली पाहिजेत आणि जे ज्ञान मला मिळेल त्याचा अर्थार्जन हा सेकंडरी पार्ट झाला. पण कोणाच्या तरी चांगल्यासाठी जर आपण वापर केला, कोणाच्या तरी कल्याणासाठी जर आपण वापर केला तर मग निश्चितपणाने आपलं जीवन सुफळ, संपूर्ण आणि तणावमुक्त होणार आहे. एखाद्याला आपण छोटीशी गोष्ट भेट दिली तर त्याचा आनंद त्या वस्तूच्या किमतीपेक्षा जास्त असतो. आपल्याला आपण पेन घेऊ शकत नाही हो, पण आपल्या मित्रांनी मैत्रिणींनी वाढदिवसाला आपल्याला पेन आणून दिलं तर आपल्याला त्याचं अप्रूप वाटतं. त्यामुळे हा आनंद सहज आपण देऊ शकतो. तसंच आपल्याला माहिती असतं काय केल्याने दुसऱ्याला त्रास होतो ते सुद्धा. त्या गोष्टी अवॉइड केल्या पाहिजेत. असं जर आपण प्रत्येकाने रोज ठरवलं की 5 चांगल्या गोष्टी करीन, 5 लोकांना छान आनंदी करायचा मी प्रयत्न करीन आणि वाईट गोष्टी शक्यतो मी टाळायचा प्रयत्न करीन आणि मनामधला कचरा निचरायचा, मेडिटेशन आहे, अनेक गोष्टी आहेत, शक्यतो रिपीट होऊ देणार नाही याची मी काळजी घेईन. माझा प्रोसेसर मी वारंवार तपासून पाहिजे आणि त्यातनं येणारा आउटपुट सुद्धा तपासून पाहिलं पाहिजे की त्यातनं मलाही त्रास होत नाही आणि बाकीच्याने त्रास होत नाही याची जाणीव करून माझं जीवन जास्तीत जास्त आनंददायी करायचा प्रयत्न करीन. सेमिनार होत राहतील, नॅशनल सेमिनार आहे, आपण 2 दिवसामध्ये भरपूर वक्त्यांना ऐकलं आहे. पण या शेवटी स्ट्रेस मॅनेजमेंट मध्ये काय करायचंय, आरोग्य आपलं चांगलं असलं पाहिजे. आपण कोविडमध्ये शिकलो आरोग्य नाही तर काही उपयोग नाही आणि आपण आनंदी असलं पाहिजे, त्याशिवाय काहीच उपयोग नाही. तर मग आपण दगड झाडं ह्याच्यापेक्षा मनुष्यामध्ये काय फरक आहे, तर हॅपीनेस इज मोर इम्पॉर्टंट. तो सगळा तुम्ही जाताना घेऊन जाल असा विश्वास वाटतो आणि महाविद्यालयाने मला बोलायची संधी दिली त्याबद्दल त्यांचे आभार मानतो. धन्यवाद.
सर जेव्हा बोलत होते तेव्हा मला पाडगावकरांची त्यांनी चिमणीवर लिहिलेली एक कविता आठवली. थोडक्यात सांगते. कोकिळ सुंदर गातो म्हणून आपण का रुसायचं, मोर सुंदर नाचतो म्हणून आपण का जळायचं, तुलना करत बसायचं नसतं ग, प्रत्येकाचं वेगळंपण असतं ग. सो जे पाडगावकरांनी त्यांच्या कवितेतनं सांगितलं, सरांनी त्याचाच आपल्याला प्रत्यय आणून दिला आणि आपण शिक्षक मंडळी आहोत, आपणही आपल्या विद्यार्थ्यांमधले चिमणी कोण, मोर कोण आणि कोकिळ कोण हे ओळखायला शिकलं पाहिजे, ही प्रेरणा दिली. त्याच्याबद्दल सरांचे मनापासून आभार मानूयात. आणि थोडीशी आता वेळेची गडबड असल्यामुळे आपण क्वेश्चन आन्सर सेशन जे आपलं आहे ते इथून हॉलमधनं बाहेर पडल्यानंतर घेऊयात मॅडमच्या परवानगीने. याच्यानंतर आपल्या आजच्या कॉन्फरन्सचे कन्व्हेनर पलट शाह सर यांना मी विनंती करते की ही शुड प्रपोज वोट ऑफ थँक्स. बरं, मॅडमची एक थोडक्यात सूचना आहे ती सांगते की कोविड स्ट्रेस आणि मॅनेजमेंट, स्ट्रेसचे शरीरावर होणारे परिणाम याच्याविषयी आपल्याला अधिक जाणून घ्यायचं आहे. तर आपण डॉक्टर स्वाती मॅडमचं अजून एक सेशन आपल्या महाविद्यालयात ठेवूयात. या सूचनेचा आपण जोरदार टाळ्या वाजवून स्वागत
Respected dignitaries on the dais, my colleagues and dear students, good afternoon to all. Thank you is such a prayer that cannot be seen or touched. It must be felt by heart. I feel honored and privileged to get the opportunity to propose vote of thanks on this special occasion. I am very much thankful to all Program Advisory Committee members and the invited speakers. Words are not enough to thank their constant guidance and support to shape this conference. I, on behalf of Sri Siddhivinayak Mahila Mahavidyalaya and HNIMR, convey deep regards and hearty thanks to our Honorable Dean Commerce and Management Faculty, Savitribai Phule, Pune University, Dr. Parakkalkar, and Dr. Swati Joshi, Psychiatrist, Dinanath Mangeshkar Hospital, being here for the valedictory function and for their valuable guidance. My special thanks to respected Srimati Vidyatai Kulkarni, Vice Chairman, Maharishi Karve Stri Shikshan Sanstha, for her gracious presence here. At this juncture, I would also like to thank our CDC Chairman, Dr. Kishore Desarda, for his valuable guidance at every stage of this conference. My sincere thanks to Dr. Surya Ramdas Madam, Director HNIMR, for her help and support to organize this conference. I am also thankful to the faculty members of HNIMR for providing necessary help and coordination to organize this conference. I would like to thank our beloved principal, Dr. Sangeeta Athole Madam, for her constant help and guidance that radiated a source of energy within us. I am very much thankful to all my faculty, colleagues and non-teaching staff members for their endless efforts to make this conference successful. I feel proud and thank all of you for making this event successful one. An event of this dimension cannot happen overnight. The wheels start rolling months in advance. We have been fortunate enough to be backed by a team of very motivated and dedicated student volunteers. I cannot thank everyone enough for the involvement they have shown and the willingness they have expressed to take on the completion of tasks beyond their comfort zones. I am very much thankful to National Commission for Women, Nan Prabodhani Pune, and our Maharishi Karve Stri Shikshan Sanstha. It would have been impossible to organize this conference without their support. I would also like to thank Suswat Canteen for delicious food arrangements for our guests. At the end, I would like to take this opportunity to thank all the participants who have published and presented their worthy research paper in this conference. If time is money, then today you have spent millions for us. Thanks to all of you for making this event successful.
Thank you so much, sir. We shall end the program with Vande Mataram. I request all the faculties and students to please stand for the Thank you.
Vande